Hello, I'm Robert, and this would be the third thing that hardly any of the people that contact me originally understand. And that is the importance of physical distancing. And that you need to do it both outdoors and indoors. Thing is, there's been so much emphasis on ventilation. And most people seem to think that it's most important to be in a well-ventilated space and be out of doors. And it doesn't matter how far away you are from someone, so long as you're out of doors. And that's not true at all. The most important thing is the physical distancing. If it's reasonably well ventilated indoors, then the physical distancing still protects you. And as you can see, here at the World Health Organization, they're sitting talking at a table, they're being interviewed, and they're not wearing a mask, they are protected. And the reason is because the droplets, you're infected mainly by droplets that come out of your mouth. And these droplets, they are big enough to move under gravity, and you don't expel them with that much speed, and so they fall down to the ground within a meter. This is the absolute top priority. Most of the transmission seems to be done through these droplets. It's less important the surfaces. They have no clear cases of being spread through surfaces without the droplets also being there. And it seems that you need quite prolonged contact within quite close up for the droplet transmission. So the ventilation does matter. If you have lots of people in a small space, and especially if they're being very active, dance, fitness or something like that, then with poor ventilation, then you've got a recipe for it being spread even over the 1 meter distance, over longer distance. But if you have reasonable ventilation, not many people, they're just sitting quietly at the table talking, then you're not in that situation, and 1 meter distance will protect you. And that also is the same out of doors. If you're within a meter, then those droplets will go, they're not going to be affected by the ventilation, they just go under gravity. And if you're within reach of those droplets, you're going to be infected no matter where you are. So the mask does help, and so they found that wearing masks does reduce the droplet transmission. But you can completely protect yourself from it by just stepping back. Now, this one thing that I'm going to say now, I haven't seen anyone else say it. I don't know why. It was a psychologist friend told me about it. So, and people talk about COVID-19 fatigue. And people who say that, they don't seem to understand this psychological thing, which they call implementation intentions. I haven't heard anyone talk about implementation intentions, in connection with COVID-19. But what it is that it's much easier to do these things if you make it tied up to the situation that you're in. So for instance, it's an implementation intention that whenever you get into a car, you put on your safety belt. You don't need to think about it, it's just automatic, you always do it. You drive to work and back every day, you never have put on your safety belt fatigue. Same for looking both ways when you cross the road, and doing up your shoelaces, playing a musical instrument. These are all things where you don't get tired. You just, you've got the habits into that situation, you just do it. So it's the same thing here with COVID-19. If you want to not be tired, not tire yourself out, if you want to stand the course right to the end, then build an implementation intention. And what that means is that, for instance, whenever you interact with someone, always step back. And then you can have exceptions, but exceptions are very clear to you. So you don't need to think about those either. Like your household, if you're together you're all being careful, then if you're all being careful afterwards outside your household, COVID-19 hasn't got into your household, it's very unlikely it gets in, then you can be okay with each other without these distancing. So then but then whenever you're outside your house, then you do the physical distancing. Always step back, and then you're in that situation, you automatically step back. Where it gets tricky is if you're constantly having to decide whenever you meet someone is this going to be am I going to are they going to physical distance? Should I physically distance? What will they think about if I don't or do? And if you just make it clear that can we physically distance? I wish to physically distance or something like that. Everyone knows what you mean, and they will respect you, even if they're not doing it themselves with other people. They will respect your decision and your wish to physically distance. So just step back. Just always do that everywhere, unless it's a situation where you can't physically distance. And then, in that case, make sure you're wearing a mask, inside or out, winter or summer, rain or shine, physically distance. If you do it like that, you will not get tired of it. It'll just be very easy to do. I mean, apart from, you might have a strong wish to want to go back to not have to do the physical distancing, but in terms of actually remembering to do it, you don't have to keep remembering to do it. And just automatically step back and get used to how far back a metre is or 2 metres. It doesn't matter much. It's most important is to step back. The actual distance isn't so important. At least a metre. And the CDC say 2 metres. And what people I help, they get very worried about short-term, like someone just walked past them. If they're not talking to you, then they haven't transmitted to you. And then the other thing they worry about is that someone just talked them very close up and then they step back. What about that short time when they were talking to you close up? Then you don't need to worry about that. The thing is, it takes you 15 minutes of talking close up, typically, to get infected. And the reason is that a single virus does not infect you. Your innate immune system can fight off a single virus or a handful of viruses, 2 handfuls of viruses. You can fight that off easily. It's probably at least hundreds, and you probably need thousands of them to get into your system before they can overcome and actually get into a cell and infect you. So that's why you need to have this. Just keep this up, and then don't worry about a little moment or two if it takes before you step back. You just constantly do what you can, and then if you do all that, then you are safe from COVID-19, as you are safe from crossing the road, from being killed by traffic when you cross the road. You wouldn't think about just dashing across a busy London street without looking both ways. And if you did do that, then maybe quite a few times the cars would stop in time, and they would see you, and they could screech on the brakes, and you'd be able to get across without being killed or injured. But after a while, you're just taking a risk each time. Whereas if you look both ways, then you could cross the road safely. Safely doesn't mean that it can't happen to you at all, because we still have some traffic accidents, but your risk is greatly reduced to just about realistically very low. And the more you just could be very careful when you cross roads. We all know that. So it's like that with COVID-19, and you can confidently expect to get through the pandemic without being infected, so long as you do this, as long as you're careful like this. So it's not an absolute guarantee, but it's like the way you're safe from traffic, and you're safe from COVID-19 if you do this. And indeed, you can be even more confident in that if you're really systematic and careful. For instance, Bruce Aylward, when he came back, he's from with the other ones, and came back from Wuhan, and he said, I can't remember how he put it, but he said, they asked why he didn't wear a mask at the press conference, and I can't remember how he said it, but he was probably the safest of all of them there in that press conference. Anyway, so I'll stop this. This is that, and then I'll go on to what's the next one. Quarantine. I thought I'd do this before the quarantine. And so you do everything. You do the washing your hands, and you do the washing services and so on. But most of all, so few people seem to realise how important it is to do the physical distancing. And then the mask wearing, You wear the mask, don't fiddle with the front of the mask. You shouldn't touch the front of the mask. But they have found that mask is surprisingly effective. So that, as well as the physical distancing, either because it's required or because you have to be within 1 metre. And if everyone did that, it would just drop off a cliff. Because the thing is, it doesn't take much. They are noted just above 1 at the moment, in the United Kingdom, for instance. Just this one measure. In fact, this measure would, if everyone did it really carefully, just drop off the cliff like that. And would soon be way down to very few cases. And if even just a higher percentage of people doing this may be enough to tip it from above 1 to below 1. All these things I'm talking about, then this could make a really significant difference. The reason we are in lockdown, the only reason we are in lockdown, is because people aren't doing this.